Welcome everyone to today's webinar, 5 must-have post-COVID marketing tactics. On behalf of Beckers Healthcare, thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I am pleased to welcome today's speakers, Danny Flamberg and Rishi Kadiwar. Danny Flamberg serves as the Vice President of HCP Strategy at LiveWorld. He is a senior marketing strategist and practitioner who has been a pioneer in crafting compelling strategies, devising breakthrough messaging, and embracing omni-channel thinking about broadcast, digital, video, mobile, and social media to support leading and insurgent pharmaceutical and life science brands. Rishi Kadiwar serves as Vice President of DCT Strategy. He works with clients to meet consumers at the intersection of innovation and customer experience. He partners with leading hospitals and pharmaceutical companies to drive marketing engagement by creating strategies that bridge both digital and physical touchpoints. He specializes in customer journey mapping, interpreting the voice of the customer, and design thinking. Rishi, Danny, thank you for being here today. I'll now turn the floor over to you.
Great, thanks so much. We appreciate the fact that you joined us today, and we hope that in the next few minutes we can share some ideas with you. We have been troubled, as I'm sure you have been, by the fact that COVID has entirely upended the positioning of hospitals. You know, classically, hospitals were a place of refuge, a place of healing, a place of science, a place of calmness, and COVID has kicked over that checkerboard pretty well. You guys probably know much better than we do the exact implications for your institution. But what we have begun to think about is the process of hospital marketing, which is in many ways a balancing of risk and reward. The patients and the populations are anxious about their condition. They're coming to the hospital in anticipation of being cured, of being taken care of, and of a positive kind of outcome. And that may not necessarily be the opportunity they have in the current environment. So we wanted to think about some ideas as some ideas that would overcome the fact that most of our classical marketing ideas have been eliminated by the general situation. So in the next few minutes, we're going to share 5 tactics with you. Some of them you've heard, some of them you're doing, some of them you're thinking about, some of them may be new to you. We ask you to keep an open mind. Next slide, please. So these are the 5 ideas that we're going to explore with you over the next few minutes. And, you know, some of you who are skeptical are probably thinking to yourselves, are you kidding me? Telling me to do social media, telling me to think like the consumer, telling me to be involved with influencers are things we all know. And on one hand, this is true. On the other hand, these areas are becoming increasingly competitive, increasingly sophisticated, requiring increasingly larger kinds of and different kinds of resources to become an effective part of your marketing mix. So hopefully in the next few minutes, Rishi and I will share with you some ideas that will enliven these ideas, that will expand upon these ideas, and will help give you some ways to think about this in your own context. The other thing we want to mention at this point is in a number of cases where we work with clients, we are in a position where we are focused more on production than on strategy. There's a sense of we've got to get this out, we've got to promote this. It's National Diabetes Week, we've got to do something. We have a new chief of surgery, we've got to announce him or her. That oftentimes the production and the content is more prioritized than the strategy. So we would ask you to think, as we look at these different tactics and strategies, we'd ask you to use the TFD filter. What I mean by that is, as you contemplate each idea and each approach, you want to ask yourself three things. Number one, you want to define the population. Who are we talking to? And then you want to ask yourself these three things. T, what do I want these people to think? F, what do I want these people to feel? And D, what do I want these people to do? So that the tactical application drives a larger strategy and leads to a larger marketing experience, and also has a greater impact on the population you'd like to influence. So for example, for this webinar, the T is going to be, we want you to think about different ways of doing things. We want you to think about the ideas we're presenting. We want you to think that there are options that you may not have thought of. Number F, we want you to feel like you've got choices and opportunities. There's some wiggle room. There's some opportunities to use limited resources, and there's some ideas that you can borrow from other people. And number D, the do, we want you to think about which of these ideas you can actually implement and take to your management or immediately begin to think about in a tactical kind of way. So with that in mind, next slide, we're going to launch into the first idea. We're going to launch into a quick poll. So if you indulge me, please look at this slide and answer, what priority do you give social marketing tactics in your marketing plan? Give you a couple of minutes to fill out the poll. Who can do the readout here? Okay, can we get a readout of the poll, please?
Well, right now we have almost half, so I'll give it another 10 seconds, and then we'll move it forward.
Terrific.
All right.
Okay, so it looks like there's heavy usage among our population. So in the category of ideas you've heard of, social media is clearly one of them. Next slide, please. So the good news is we all know about social media. The bad news is we do it in various different kinds of ways, and it's becoming much more competitive. So the average hospital is active on 3 to 5 social media platforms. And the average hospital marketer has reported that they are going to increase their spending and their attention to social media. So there's going to be more noise, there's going to be more competition, there's going to be more people competing for the ears and the hearts and the minds of patients and caregivers. One of the key elements of a social media strategy, though, has to be to understand where we are and what's going on. And that calls for twin tools of social listening and social moderation. You want to have an active listening program on all the time. You need to understand what's going on around you and who's saying what about which topics. These conversations are happening broadly on a lot of different platforms. They are geographic-based, they are institution-based, they are condition and disease-based, they are patient-centric, and you've got to understand the language, the threads, the intensity, and you also have to understand how this is being played out in on your platform. So you've got to have a good listening tool. You've got to be listening regularly. You've got to have a good community manager or moderator. You've got to be moderating, responding, and collecting data on a regular kind of basis. Next, please. Because social media is a barometer for credibility and believability. 8 out of 10 people in this survey indicated that they expect a hospital to be on social media. And this is similar to a few years ago when everybody expected you to have a website and an 800 number. And not only do they expect you to have it, more than half of the people in the survey indicated that they expect to be influenced by it. So they expect to find you on social media, to have information from you on social media, and they expect in many ways to be persuaded or informed or educated by you on social media. The next step, of course, the next slide, please, is to benchmark yourself. And here again, how many of us have studied the impact of social media as opposed to the content production of social media? How many of us know which content works best what the highest engagement levels are, what the best time of day or day of week is for posting, which are our best formats. Is infographics better than images? Is images better than video? So there's two elements to benchmarking. Number one is internal benchmarking. What's going on your platforms? What's working best? Are you aware of the various elements that are at play? And the other is external. So almost everybody has a Yelp page, which is about reviews. Almost everybody has a Facebook page, which is about reach against a major audience. And about half of the people surveyed, or half of the institutions surveyed, had a Twitter page to engage in real-time marketing and real-time conversation. So you want to understand what's going on in your world, what's the most effective, but you also want to understand what the competitive set is and how the competitive set is going to affect you in the long run. Next slide, please. And one of the things about the competitive set is that if done right, social media can allow you to punch above your weight. In the case of the Roswell Park Cancer Centers, as rated by U.S. News, there's a small group of cancer centers in Buffalo that, because they were extremely good at social media, were able to get more attention, more traffic, more opportunities to convince and persuade than their general ranking would otherwise dictate. So social media skills is critical for positioning yourself and for overcoming competitive challenges. Next slide, please. Increasingly, what's interesting is we want to look at social media from a variety of different standpoints. It's becoming more scientific, it's becoming more sophisticated, and the people who are doing it best are publishing twice as frequently as their competitors. So you really want to look at social media in a number of different ways. Number one, you want to understand what the attributes of the platform are, both technically and psychodemographically. So for example, how many of you know that Instagram has a huge African-American population, that Facebook is overwhelmingly adults 25 to 34, and that Twitter has the greatest number of college graduates? So the demographics, the psychographics give you an idea of population. And the other thing that you want to think about in this regard is that these are not homogeneous groups, that you can reach different segments using these platforms at different times with different content. The other idea, of course, is that frequency is important, that each of the posts or each of the ads you post have a distinctive shelf life, so that this dictates a certain amount of frequency. In fact, you'll see in the slide that New York Presbyterian publishes up to 7 times a day because of this frequency. But for example, did you know that the average tweet lasts 15 minutes, whereas the average post on Facebook lasts 6 hours? The average message on LinkedIn for 24 hours. And the winner in this derby, of course, is Instagram, where information and posts last 48 hours. So understanding not only how long they last, but what the sequence is and how the sequence plays out against the FTD model is critical to having an effective kind of program. The other thing you want to think about is, can you use the skills and can you use the attributes of the platforms to maximum effect? So for example, how many of you have done a Facebook Live event? How many of you have created a community or a webinar using Facebook groups or Instagram groups? You want to understand the nuances, you want to understand the technical limitations, and you want to feed the beast in each particular way that makes the most amount of sense. Increasingly, what the case is that short video is becoming the key creative element in social media. Think about YouTube Shorts, think about IG Reels, think about Facebook Reels. These are becoming the dominant way of communicating. So everybody has to have a strong organic video resource to be able to keep up with the Joneses. And then, of course, there's the TikTok effect. TikTok has come on the scene and dominated in many different ways, and it's changed the way we think about communicating with patients and caregivers. Next slide, please. In addition to that, so now you're thinking, oh my God, I've got to create all this material. I've already got all this pressure. How am I going to do that? And one key answer to that is by mining user-generated content. I'm sure you've all seen the research that shows that people believe in the wisdom of the crowds, that people believe the content shared by other people like them, the person-to-person influence, the people going through the similar experiences have great credibility. So this is an opportunity for you to read what's going on, to react to what's going on, to repurpose some of this information, to repost it, to retweet it, and to add to your content curation by using this as an active tool. So there's two elements to this. Number one, you want to use it as early warning radar. You want to see what's being talked about, the language that's being used, the frequency and the intensity of the conversation, but you also want to mine it for content that you can use to make your points, to row your boat, and to push your service lines in a marketing kind of way. Next slide, please. So TikTok has captured the imagination of everyone. It is growing at an incredibly fast rate. The numbers have already exceeded Google and Facebook. Now, using TikTok is obviously the first filter is risk appetite. So many of our hospital administrators and many of our hospital executives will shy away from this. But it is a way to reach young people who are flocking to this platform in droves. In the example that's in the slide, the 7 New York City hospitals banded together for a test campaign. They employed a ballerina and a fitness expert as their spokespeople, and they generated 3.5 million impressions. So the idea being you can not only use your own resources, you can reach out to other resources and other influencers to shape a TikTok campaign. Again, some of this has to do with the risk appetite of institutions. So for example, St. Jude has 55,000 followers on TikTok based on a campaign to generate younger donors. And the Cleveland Clinic ran a mask up campaign, which generated 1 million views. So there are an opportunity to use this. And back to this idea of using the attributes of the platform. In the case of TikTok, you have a lot of lip syncing, you have a lot of dancing, you have a lot of confessions, you have a lot of people mugging for the camera. These are creative cues that can be used effectively to capture this medium and to put it to work on your behalf. Next slide, please. The other thing that we've talked about is this question of benchmarking. So the Cleveland Clinic noticed that a huge number of people visiting their platforms were women in childbearing years. They also connected this idea to their maternity and OB practice, and then linked it to the current question about boosters. So here's a particular opportunity of taking a relevant content, highlighting key service lines, connecting it with key demographics, and kind of super serving your audience. So again, understanding who's coming to your platforms, understanding the demographics of those platforms, understanding the creative palette of those platforms are key ways to improve and extend your ability to use social media. So not only are you just cranking out videos or getting pictures of those nurses dancing, you are impacting particular segments of the audience with distinct marketing messages. Next slide, please. The last thing I'll mention in this area of sophisticated social media is the idea of using online communities to drive service line marketing. We've built an online community for Mount Sinai in New York aimed at the adult children of dementia patients. And in a 6-month time frame with very modest promotion, we've attracted 1,200 community members, half of which are active every month in terms of commenting, reacting, posting, and generating user-generated content. So it's an opportunity to build an emotional bond between the hospital and a patient population, which remember and keep in mind that in many cases, the hospital is a necessary, not a priority choice for people, that it takes you beyond the treatment and it offers the opportunity to expose various attributes and various resources. In the case of the Mount Sinai community, 10% of the people in the community have already accessed the select a doctor or make an appointment features. And this also nets an opening to other medical and resources that we wish to expose to that population. The idea behind the community is not only to super serve a particular population where there's a chronic or ongoing need, but it's also the idea to implant the idea that you have a relationship with the hospital, so that rather than just a transaction when you need an operation or need a scan, that you think of a hospital, you think of your institution as part and parcel of your human toolkit, in the same way that you've got a guy to help you with your, you have a handyman to help you with your house, you have a hospital that's part of your consciousness, and is the first place you would turn when those medical needs arise. So this is a good segue to the idea of building relationships that Rishi's going to talk about next.
Yeah, thank you so much, Danny. And before I jump in, we have a poll question next. We had a question in the live chat that I think we should address right now. And it comes from Maureen. How would you address healthcare misinformation when employing user-generated content in your social strategies? So, Danny, do you want to take that one, or do you want me to chime in?
I think you have to confront it directly. I think you have to attack it directly. You have to be instantly responsive. You've got to cite sources. I know this is difficult and I know this is emotional, but I think that the population expects the institution to be scientific-based and fact-based. I think they give us that credit, and I think you've got to jump on this stuff right away. All the more reason for consistent social listening and regular moderation. I hope that answers your question.
Yeah, Danny, I would just add something else, right? If you're going to use that user-generated content on your own networks as well, and if you're going to retweet it, let's just say you always want to go back and get the written approval of the person whose content you're going to be sharing. And prior to doing that, all that content should be vetted by your legal team as well.
Yeah, so you've got to have those elements in place, and you've got to be prepared to do that. But the advantage, of course, is that from time to time, you will get a testimonial or you will get a point of view which comes from the users, which may not necessarily be something that you could say about yourself. So there's some goodness there as well. On to the poll.
Yep, so we got our poll. Have you created an online healthcare community? Yes, no, but may build one this year. So we got 10% in, we got 16% in. I'll give it 15 more seconds. All right, we got 67% no's, but we got a healthy amount of yeses, and we got 14% who currently don't have one, but they're considering it. So, we got a good opportunity to engage our marketplace right now.
Let's skip that.
All right. Well, thank you so much, Danny. Like Danny said, my name is Rishi Kadiwar, and our second tactic here is how to build sustaining relationships, right? In the past, patients in hospital had a very transactional relationships. Patients only sought of hospitals when they needed a point-in-care solution. But now that relationship has shifted to always on. Patients expect to reach hospitals on their own terms 24/7 whenever they need them, especially on the hospital's owned channels like Facebook, Twitter, or Instagram. And say at 2 in the morning, if a patient can't reach you and get their question answered, you better believe that they'll let you know about it by leaving a negative review. So we got to be prepared as hospital marketers to always be always on and to be engaging 24/7 if possible. So by positioning yourself as the go-to resource in the marketplace, you'll always be top of mind. And aiming to be top of mind seems like a marketing no-brainer, but how do you do that in a highly competitive Google landscape where we know that people are only looking at the top 5 to 7 results on Google before typing in another search term or another search phrase. The benefit of becoming a thought leader and by providing your audience with the content that they need is within Google's local search functionality, it will position you and your hospital above your peer set. So, and this is a great example from Northwestern Medicine, right? They have curated on their website featured content around healthy living, mental health, and patient stories, as well as other things. So whenever someone Googles something around mental health and they are in that geographical area, the Northwestern website will show up, theoretically higher than the University of Chicago Medicine's website as well. So it really gives you an advantage in your own local market. And then you really want to show why you are the trusted provider, right? When a patient or a caregiver comes to your website, they should have no doubt why they'll be in good hands at your institution, right? And Mass General does a great job with this, right? They have specific language cues that guides their visitors on their website throughout the website. They have elevated the latest, most relevant news, say around COVID, to positions on the website which are easy to find. Visitors have no issues, using the Find a Doc tool or the Find a Researcher tool. The top languages that their audiences are speaking are featured on their website, so there's an easy conversion that can happen based on the language. And all the awards that they have won are front and center. So when a patient or caregiver comes to the website, there is no doubt why they'll be in trusted hands. And we then want to take that relationship from online to offline, right? The old saying that trusted build with consistency could not be more true than in hospital marketing, right? Hospitals need to continue that relationship from online all the way to offline to form that bond, right? We know that 49% of users say that when they share an entertaining piece of content that is also educational, that it will result in a change happening within their peer set. So we need to be able to provide content that is not only entertaining, but also educational, right? And an example we have on the screen right now from the University of Pittsburgh Medical Center is a great illustration of that. They have a SMS program that can send their audiences healthy living tips to really engage them and to really bring them back to the center hub of the website. And then they have also gamified the process to continue this online to offline component around a quiz that they offer on how to combat SAD, which is around mental health awareness, that users, when they complete the quiz, can share that within their network to really kind of grow that network effect. And then we want to take a 360 approach so we can always have a surround sound and to create that ongoing relationship. We can be exactly where our audience wants to be, regardless of where they turn. So Hopkins does a wonderful example of this, of taking this 360 approach. They offer tailored newsletters based on a personal profile, so it serves their audience exactly the content that they need. They have a very robust CRM stream that delivers messages on an ongoing regular cadence, so not to overly spam their audience, but right when their audience needs a key piece of information, Hopkins is there. If their audience is in their My Chart portal, they'll have relevant content being served to them within My Chart. And then they also offer online communities, for patients with MS or burn survivor support groups to really kind of take this online to offline component where they're really fostering this community to make sure that their patients and caregivers are getting the support they need, regardless of if it's on the Hopkins website or in an offline or online support group. And then all great hospitals are asking their satisfied patients to share their experiences. I would actually take it a step further and say that we need patients, all patients, to share their experiences, because this will give us valuable first-party primarily sourced data that can help our hospitals learn, grow, and adapt, and make sure we're there for all our patients, right? We don't want to shy away from negative reviews. We want to meet the patients where they are and make them comfortable enough so they can share their experiences. Rivers Hospital in the UK does a great job at doing this, right? They allow patients to provide feedback on multiple channels, which include Facebook, Google reviews, or the National Health Services website. So whatever channel the patient or caregiver feels comfortable being on, there's an opportunity to provide reviews back to the hospital. And whenever we're talking about reviews, we gotta be talking about moderation. Moderation matters, right? I know on an earlier slide that Danny had up, it was 99% of hospitals have a Yelp page. Well, that's great, but ask yourself this question: if you needed to go and amend something on that Yelp page, do you know what person to turn to at your hospital who has the password for your Yelp page? Are they even still employed at your hospital, right? And the answer is probably you guys don't know. So that's why when it comes to moderation, moderation matters, right? People are getting more comfortable with leaving online reviews, but ultimately only two types of people really comment and leave reviews. Either people that are really, really happy with the services you provided them, or people that are really pissed off. And we want to ensure that we are addressing those people that are really pissed off. We're addressing their comments, we're putting them at ease, and we're trying to solve their issues before those comments snowball into a massive PR issue. The third tactic is we want to become our consumer, right? If the consumer doesn't believe that we are their sole priority at a hospital, they will take their business elsewhere. That's why it is so important to serve content how, when, and where consumers want to consume it. And we want to be speaking to the consumer on a one-to-one basis. As much as possible, we want to curate content and tailor content so it is personalized and individualized to the consumer, so the consumer really feels like they have a bond and a relationship with our hospitals. Right. We want to invest in building a welcoming and frictionless consumer experience as in few clicks as possible. And the magic number is 3. If someone can't find the information they're looking for in 3 clicks, they'll take their business elsewhere. So we want to ensure that the hub of all our information, our website, it has a very clean, flat design, that there isn't too much going on, but there's just the right amount of content on it that is easy to navigate. It has large and ADA compliant text and call to action buttons, and that the most relevant, popular, trending information, i.e. COVID information, is visible in a prominent space that as a visitor, they can very easily find it. I would take this a step further and say that we could do some advanced IT integrations, and we could tailor this content based on Google search results. So the front page topics are tailored to the search terms that someone was searching for. So then our website becomes hyper focused and hyper targeted to that audience member. And like I said before, we are living in an always on world, and we need to position our organizations as always on. 64% of consumers think businesses should contact them via text, but only 61% of marketers still do it. So there is a gap here of being always on. We want to use text messages to keep patients on track and to keep them adhering to their treatment protocols. But whenever we need to send bulk a notification, SMS text is a wonderful channel to do that. And it goes without saying, we want to be where our patients are, right? We want to target media on the correct channels to ensure that our patients and caregivers are getting our messages, right? We want to aim for consistent messaging across all our platforms, but we want to make sure our messaging is appropriate for that given platform, right? So this does not mean having copy and pasted Facebook content on Twitter, right? And you can't do that. There's a character limit on Twitter that Facebook does not have. So even though we should be speaking in the same brand voice, we want to make sure all our content is platform specific. So when our audience is on a given platform, they are getting the content in the correct way that that platform is meant for. And the fourth tactic here is we want to curate patient stories, because patients are really our brand advocates here. Everyone has a story to tell, and there is almost unlimited appetite to hear and relate to them. So a great example of this is the University of California, San Francisco Health. Their patient advocate strategy is co-telling stories, co-telling patient stories with partnership with their HCPs. So the way they approach this is they'll have a patient and an HCP cutting in and out to actually tell that patient story, one from a patient POV and then one from the HCP's medical POV. So an example of this could be an orthopedic patient who was in a debilitating car accident, and how the orthopedic surgeon at the hospital helped that patient walk again. Or it could be a patient who had a brain injury, and how a treatment protocol and a 1% chance of success surgery from a neurosurgeon help that patient live a normal life again. So we want to make sure we are partnering our patient stories with the HCPs to really complete that picture. And then we want to show our humanity, in the stories, we tell, because it is very important to notice we're just not putting content out there for the sake of putting content out. We're using our patient stories because there's other members of the community who may be going through something similar, and this will help them find advocates, for their own reasons. So an example we have here of New York Presbyterian Hospital, of little Ivy Grace Washington's, success in the, neonatal care unit is, it is so much more about the success, but also if you were to read these comments here, there were mothers who were going something similar who came across this story on Facebook, and there was other members commenting on them and forming a bond and forming a community. So in this example, New York Presbyterian did so much more than just put a piece of content out. They were community builders that kind of elevated their brand to overall patient care. And then before I jump to the next slide, Montefiore Hospital did an example of where they took their patient stories a step further. They actually told it not only in the voice of the customer, but they let in the voice of the patient, but they let the patient kind of take a dark tone to it because it was something real that the patient was, was going through. So I'm going to play this audio clip, and then we can chat about it.
I like finding the bon mot, the witty line, and so I came up with a slogan for it, which was, because you're not allowed, quite rightly, to pay people to donate an organ. And so I came up with a slogan of, I'm not asking you to open your wallet, just your abdomen.
So I'm not asking you to open your wallet, just your abdomen, right? And that is, some dark humor right there, but it is very, very pertinent and very impactful, for patients who are going, to something similar, where they can really relate to this, and kind of get behind it. Now, when we're telling patients stories, how we tell those stories matter. And there's a few tips and tricks around that, right? So videos showcasing patient stories will almost always perform better on social media, versus static images. We want to use hashtags to coalesce around communities, and we want to ensure that the hashtags we're using, patients and caregivers can use those hashtags to create their own communities behind those and to catalog those communities. If you're posting something on Instagram, half of the best posts include 2 or more faces. So a patient and a caregiver, a patient and a HCP, a mom and a child will always perform better versus a single image. And then posts with a strong storytelling angle, like a behind the scenes point of view, always attract the most comments. So I'm going to pass the ball over to Danny now, who's going to jump in and talk about how to engage influencers.
Like TikTok, influencers is the new black. There are many different kinds of influencers, and they grow out of the fact that as a country, we are a nation of reviewers, critics, and recommenders. And that idea of person to person, that idea of commonality, that idea of getting knowledge from people that are like us, that are living near us, that are the same demographic of us, is part and parcel of our human experience in the world of communication. The trick here, of course, is understanding who these people are, what their perspective is, how they've set them up. We've seen influencers that position themselves as critics and reviewers. We've seen influencers that present themselves as reporters. We've seen influencers who position themselves as neutral observers and aggregators of information. But they are credible, and they should be part of your consideration set. Next slide, please. The idea, of course, being to marry your marketing needs with the target population, with the TFD formula. So, for example, there might be a mommy blogger that would be the perfect influencer and connector to a pediatrics practice. There might be a senior fitness person that might help promote a geriatrics practice. There might be a sports blogger that might row the boat for orthopedics. So understanding who's available, and some of them are local, some of them are by topic, some of them are by condition, some of them are by demographic. And in the case, the case we talked about before, where the New York hospitals reached out to a ballet dancer and reached out to a fitness guy, it doesn't necessarily have to be a medical personality, but that's also an opportunity for you to position members of your staff as influencers, taking a point of view, interpreting events and medical information for your target audience. So you want to marry the marketing objective to the population, to the platform, to the influencer, and you've got to vet these people very carefully. And frankly, if you want, we have a methodology for that we can share with you. Next slide. So when you finally pick an influencer, it's got to be it's got to be a two-way street, where you share information, where you co-create information, where you mix it up and share resources, but also where you measure. I mean, the value of an influencer is influence. And the question is, do they generate reach? Do they generate response? Do they generate shares? Do they generate access? What are the criteria for measuring the value of influence? Not just you've got the latest person or the person with the funniest color hair, but do you have somebody that's going to have credibility with your audience, that's going to carry the message, and that's going to be integral to your thinking about how to influence the population in your general direction. And the good news here, and the next slide, please, is that you don't need to have a Kardashian to be a key influencer. In fact, there's a fair amount of existing research that shows that the smaller communities, the smaller the audience, the greater the influence. So that micro communities and micro influencers in many cases are more affordable than the Kardashians, but also more persuasive than the Kardashians, because they represent a tighter connection and a tighter link to the population you want to serve. So hopefully you can begin to think about influencers in this way. Again, there's a risk appetite question that will certainly come up. And there's also the question of vetting and contracting, which can be tricky or can be pretty straightforward. Next slide, please. So hopefully by now we've shown you these 5 ideas. Hopefully we've given you some things to think about. Hopefully we haven't overwhelmed you with details and data, but hopefully we've given you an opportunity to think about them, an opportunity to feel like some of these things might make sense, and an opportunity to do something about them after this webinar and as you begin to flesh out your plan for the rest of 2022. Thanks for your attention. We hope you'll think differently, you'll act differently, and you'll be differently, and be as successful as you possibly can. I think we're done with the slides, and we're ready for questions.
Thank you so much, Danny and Rishi, for a great presentation today. Like Danny said, we will now begin today's question and answer session. So you can submit any questions you have by typing them into the Q&A box on your screen, and we'll get started with the first question now. So the first question that came through, this person wants to know, what's the best way to avoid the trap of building content on rented land? And Rishi or Danny, either one of you want to chime in on that question?
Sure. So
I'm not sure I understand what rented land is. I'm assuming you're talking about posting a comment on somebody else's platform. If that's the case, it's got to be factual, and you've got to be concerned about the context in which the message is framed. I hope I'm understanding that right.
Yeah. So Danny, and I would add one more thing to that, right? There's a way to actually have this part of your larger content strategy where, anything that you're posting in the social networks, i.e. the rented lands here, are already being posted on one of your own content hubs like your website, right? So then you're just transitioning that piece of content over to a social media platform and modifying it, to be delivered in the way that piece of content needs to be delivered on that platform. There's also integrations that we can pull in through these the social media APIs that will put the content that we have on the social networks on our website. So whenever someone comes to our website, they can also view our tweets or our Facebook posts as well, and it just becomes part of our content hub as well. So I hope I answered that question.
Yeah, thank you both so much. I think that's what our person that's tuning in today who asked the question was getting at with rented land. So really great advice from both of you. We've had several more questions come through, so I'm going to go ahead and move on to the next one. And the next question is, how would you address healthcare misinformation when employing UGC in your social strategies?
Yeah, so I think we answered this one earlier, right? But it was around, making sure before you repost any content that your team had vetted that content, thoroughly. And if you then want to repost it, reaching out to that individual, getting their permission, doing some background information, doing your due diligence on it to make sure that, what they're typing is actually factual. Now, can you stop someone from taking over your hashtag? No, but by pushing enough content and by having a strong enough following, any type of misinformation should be depressed, and the social network, will be pushing up the factual content, ahead of it.
Great. Thank you so much, Rishi. And moving on to our next question today, this person wants to know, in terms of omni-channel marketing, do you find that healthcare entities are able to brand their connected parts as a whole, or do healthcare entities have difficulties aligning their goals and objectives?
I think the leaders in the hospital space do a very good job of creating an umbrella branding idea and sub-branding the service lines underneath it. I think that there's a fair amount of research that shows that the contributing parts add to the overwhelming idea of the whole, and that there should be some consistent visual branding that reinforces this as you move forward in an omnichannel kind of way. The other thing that you need to think about as you're thinking about omnichannel is, what is your omnichannel strategy? There are generally two potential directions. Number one is the roadblock direction, where the same message is communicated across platforms and across channels. The other is the distributed idea, where the message is broken up into pieces and parts and distributed to different channels and different platforms where they can address different audience segments. Rishi, you want to add to that?
No, I think that explains it pretty well. Thank you.
Okay, great. And Rishi, did I interrupt you, or were you adding something additional there? Okay.
No, you did not. Please continue. Great. Sorry about that.
No, absolutely fine. I wanted to make sure we could fully answer that question. Danny pointed to some really great examples, so we'll go ahead and move on to the next question. This person says, my team has been throwing around the idea of TikTok accounts, and we haven't found a hospital or health system that has done it really well. Are you guys connected to anyone who does?
So, TikTok is interesting, right? It is an emerging platform. As far as healthcare, they are dipping their toes in it. They're being very cautious about it. They are using it as a branding mechanism. Mount Sinai does a relatively good job at it, but I think where there is real opportunity for hospitals is by partnering with their own internal HCPs and using their own POVs to actually tell the stories and actually, elevate the hospital's brand. There's so many doctors and nurses right now who are walking around the ER floor or in the stairwells doing TikToks. And a lot of times there's a hospital logo right behind them. Now, the hospital may not be privy to that, that TikTok being recorded, but they're already doing it. So what I would recommend is, if I'm a hospital marketer, is to find your internal champions, within those HCP segments, and partner with them, and bring them on board, bring them onto your marketing teams, as de facto members, and help them, come up with their content pillars and their content themes, so then they can be creating content, on your behalf.
I think there's also a great imperative. Everybody wants to try the new thing. Everybody wants to be involved in the new thing. I think the cases that we showed, the Cleveland Clinic and the New York City hospitals, impressed us with their ability to put out a TikTok. But you have to really ask yourself, how does a TikTok of nurses dancing, how does a TikTok of people doing something in your facility, how does that really row your boat? Or is it just keeping up with the Joneses, or is it just bragging rights to say we're on TikTok? There are some serious issues about oversight on TikTok. They don't have many of the moderation protocols in place that other platforms have. So I want to encourage you, because obviously people are going there, and obviously it's a place where persuasion is happening. But just to keep up with the Joneses, or just to have the first mover advantage, doesn't seem worth the time and trouble, at least from my perspective.
Great. Thank you so much, Danny and Rishi. Great advice for everyone tuning in today about dipping their toes in TikTok and getting on there, and advice for if they do. We have time for a few more questions today. And the next question for both of you is, are there any HIPAA or legal concerns when creating online healthcare communities?
Oh, absolutely. There's a whole series of protocols. There's a whole series of rules. There's not only is there HIPAA in terms of protecting the people in the community and their information, collecting the minimal amount of information about everybody. There's also the question of not practicing medicine. So there's got to be disclaimers. There's got to be careful moderation. There has to be a security protocol. In the case of the Mount Sinai thing, you have to answer 3 questions to join the group. The group is carefully monitored every day. We've kicked out a few people. We've taken down some posts. We've been very careful about exposing the information. So, and we have I have a legal team that has helped us along the way. So the short answer is yes. There are some HIPAA concerns, there are some privacy concerns, there are some security concerns that have to be managed, but they are doable, especially if you've got a can-do legal team in place.
Thank you so much, Danny, for that advice. And there's, of course, a lot to explore and a lot of rules that we can't go into detail on all of them today, but thanks for giving that overview for everyone. It looks like we've worked through most of the questions that have come through for our panelists today. We have had in the Q&A chat box some individuals who are sharing their experiences. We have someone who says not to toot our own horn, but I think we're doing a pretty good job at Nicholas Children's. Check out at Nicholas for Kids. So some promotional things here in the Q&A box as well. But I do want to once again thank Danny, Rishi for the amazing presentation today and LiveWorld for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us today, and we hope you have a wonderful afternoon.